because you've done a lot of work in both the AI space and the bioethics space. How did you go down this track? Like, what motivated you down this avenue? Because
Yeah.
it is a little bit, I have to say, admit, it's a little bit esoteric. It's a very different way of looking at like the technologies in general.
Right, right, right. And so, I guess my background has really driven me to care about how we think about diverse populations and equity in healthcare. And so I've always had this focus on, health equity and health disparities. And so once I started really, and data has always been sort of a driving force behind my career, and understanding, how data can be so helpful to understand a lot of these problems and issues and questions we have about healthcare is so enlightening, but also understanding its limitations and where it can provide cause harm to different populations. And so because of my background, where I've grown up in a very rural setting where we did not have healthcare. We were not somebody who was represented in the data that's being used today to develop these models. I'm very sensitive for how these algorithms can potentially widen that disparities gap. And this kind of takes us back to that conversation with Evo too, is that I was really adamant and the team was really adamant that we didn't want to just develop another tool that is going to only benefit a population that already has much of the benefits, right? We wanted to ensure that it worked across all populations equally. And how do we do that? Well, we did that by ensuring that it wasn't just trained on the human reference genome, where we know it's missing a lot of diversity. And so I think that, you know ensuring that these tools we develop really benefit all populations, and wearing my hat, benefit like populations that I came from, is really important.
That's amazing. Of course, from an occupation perspective, there's many occupations that could have actually, you could have gone down. Obviously, incredibly intelligent. Of course,
Of
I'm not.
course.
I know you have. So you could have probably done anything. So you could have been probably a lawyer that tackled this issue, or a doctor that tackles this issue from sorry, by doctor I mean someone who, like practicing medical medicine
Medicine.
in,
Mhm.
say, rural, like say rural America. You could have done it that way, but you took like the science route, and a very, like, about ethics, but melding that with technology route. Like, what why down that route? Like, what was it about your childhood, or
Yeah,
how you growing up, that
so I will say that, so I grew up in a very small town, a very rural town, where there were no, at the time there were no colleges. There were, it was very small. But one thing that I liked was data and technology. So, and it was one thing that I really could understand and grasp. And so when I went to my parents and said, hey, I want to go to college, they were like, well, why? Why why would you do that when there's so much to do here at home, etc. And so when I first went to school, I was like, well, because I grew up in a rural area where we had a lot of farm animals, etc. I'm like, well, I'm going to become a veterinarian, because that way I could bring it back home. And they were like, okay, yeah, that sounds great. But so of course, once you take the girl from the rural environment and put her in a big city, and just that whole world explodes of opportunities. I went down several different paths. And so I was really considering medical school. But to be honest, for me, it was the balance, right? I really wanted a balance between sort of that population effect versus that individual care. And so I went down the route. I first went to graduate school for public health and chronic disease epidemiology. How do we think about cancer? How do we think about diabetes? How do we think about the data needed to understand the epidemiology and the development of these diseases? And then from there, it just kind of went down that path. But I always thought there was opportunity to think about how data in particular could really help us think about a lot of these disparities, differences, inequities in our world.
God, excellent. Appreciate that very much. Everyone seems like a lot of people I talk to, they want to be a vet. It seems like very common theme amongst everyone. I think I would have loved doing that too. I have a dog, and
Yeah,
she recently had to go to the vet, which is, I mean, that was just such a scary thing for me. Never having
right.
a yes dog before, and the vets are amazing. They just make you feel so like they're special people. I have to say.
Yes, right, exactly, exactly. So I think it was, for me, it was my passion was really data and thinking about, how we can use data to address these problems. And I think I was fortunate that, when I started really, diving into my academic career, I had the opportunity to study electronic health records. I had the opportunity to work with like statisticians and data scientists and really learn and understand how we could pull those together. So I think it's really about knowing your passion, staying focused in that passion, and using the tools and resources you have to move that forward.